Hi everyone, my name is Victoria, and in today's video, I am going to be sharing with you on healthcare assistant interview questions and answers. I got the request to make this video from my friends who are healthcare assistants and who I helped prepare for their interviews. With my background as a healthcare assistant with over 10 years experience in domiciliary care, nursing home and NHS hospital, before transitioning into nursing, I have a first-hand experience of what I'm about to share with you. So, stick with me as we share 10 questions that will ace your healthcare interview and help you pass it first time. So, let's dive in. Number one question is always, tell me about yourself or introduce yourself. Here, the interviewer does not need you to talk about any background or experience that has nothing with healthcare assistant role. Here you are required to talk about the skills and experiences you have that is relevant to this job. If you have not taken a healthcare assistant role before, you can bring in transferable skills that fits into the job description, like communication, teamwork, time management, and empathy. So here is my example answer. My name is Victoria. I have worked as a healthcare assistant and support worker for over 5 years. I have worked with different clients or patients with dementia, mental health, learning disability, and vulnerable adults to ensure the delivery of personal assistance in accordance with their care plans, ensuring that all protocols are met. Over the years, I have developed resilience, which has enabled me to build emotional strength, to stay calm under pressure, and connect with patients on a human level. I have also built on my empathy, which is a core communication skill needed in healthcare. Question number 2 is, what is the role of a healthcare assistant? My example answer is, the role of healthcare assistant revolves around caring and supporting patients with their immediate needs, such as washing, dressing, and maintaining their hygiene, as well as helping them with basic day-to-day activities, supporting them to eat if they are unable to feed themselves, and to move about if they have mobility problems. In some cases, we do prompt medication, for those that get their medication in dosette boxes. Some patients might just need companionship, so we stay with them, listening and talking to them, and perhaps encourage them to go out and about. Now, if the interview is for NHS role, you will have to include taking and recording basic observations, such as blood pressure and temperature, and escalating concerns to the relevant people. Question number 3. What is confidentiality? My example answer is, confidentiality is the obligation to keep a patient's information private and secure unless consent to release the information. Example, if a patient has mental capacity and do not want his information to be passed on to any of the family members. It is the duty of the staff not to disclose the information to unauthorized individuals. Question number 4. What is abuse and what are the types of abuse? My example answer is, abuse is when harm or distress is caused to someone. It is essential that all healthcare workers recognize abuse to protect vulnerable individuals and ensure their safety. Abuse can take many forms, including physical, verbal, emotional, financial, sexual, institutional abuse, and neglect. Question number 5. What do you understand by safeguarding? My example answer is, safeguarding is the protection of vulnerable adults or children from abuse and neglect. It is the responsibility of every healthcare worker to protect the health and human rights of people who are at risk of abuse and neglect. Question number 6. What is dignity in care? My example answer is, Dignity in care involves supporting and promoting the patient's self-respect, irrespective of any differences. Making sure that the patients are supported to maintain their independence, choice, and control over their lives. An example is being able to respect the patient's privacy. While giving them a wash, cover the exposed areas. You take their preferences into consideration. For example, if a female patient says that she doesn't want a male carer, this wish should be honoured. Also, it is important to promote their independence by encouraging them to do the things they can do by themselves. Question number 7. What is equal opportunity? My sample answer is: equal opportunity is the right to be treated without discrimination, regardless of background and ability. For example, in the care sector, everyone should be allowed to access the same level of care. Question number 8. What is infection control? And my example answer is: infection control is controlling the spread of diseases or reducing the spread by ensuring the use of PPE, like wearing gloves, aprons, and masks when required, and practicing hand hygiene. It also involves regular cleaning and disinfecting of surfaces to eliminate potential sources of infection. Question number 9. How would you handle a challenging or agitated patient? In some cases, this question can come as a scenario question, like, if you encounter an aggressive patient and he starts screaming at you, what would you do? These scenario questions or situational judgment tests are used to know how you handle real-world scenarios. The questions are used to assess your skills, social intelligence, and behavioral traits. So my example is: remain calm while keeping a safe distance. Actively listen to their concern. Use a reassuring tone to engage in conversation. In some cases, it may just be that they want a cup of tea, and offering them that may de-escalate the situation. Or it may be that the patient wants to know why his medication was changed, and explaining this to him might de-escalate the situation. However, in other cases, the patient might continue being aggressive, and this is where you will need to escalate this concern to the manager or the nurse in charge. It is important to remember that you will have to escalate any concern if you are not able to handle it. Question number 10. Who is a vulnerable adult? My example answer is: vulnerable adults are people who are over the age of 18 years and unable to protect themselves from harm, neglect, or exploitation. This could be due to age, illness, disability, or mental health issues. These are some of the key interview questions and answers that will help you ace your interview. However, if you have any questions or need help with specific interview concerns, drop your questions in the comment section and I will be happy to address them. Don't forget to check out my other videos for more tips and insights to help you succeed.